Good morning. My name is Namita Sood. I'm one of the PH physicians from Columbus, Ohio. I've been dealing with this disease for the last 20 years. So I'd like to welcome you all bright and early to this session to focus on the caregivers, the mental issues faced by the patients and the caregivers. And I want to make it interactive, so I want you to bring up your suggestions, your questions and so forth to the panel. But I'll just start by sort of talking a little bit about my own personal experience, because I kind of dealt with some illness myself, and also what I perceive as some of the issues that come up. And of course, I'm not pretending to be an expert on it, but just sort of throwing some ideas out there to open it up for a discussion. So, and then as I'm done, then I'll let my panel introduce themselves and give their ideas. So I think when you're dealing with, I think it all starts with several things, sort of being diagnosed with, first it's the process of not feeling well, then being diagnosed with an illness, that whole process of going through the medical system, meeting with all these strangers, everybody's asking you the questions, probing, and you just, it's very... Nothing is pleasant. I don't think something as simple as a chest X-ray is pleasant, even though it's very, very, of a lot of the other things, it's less invasive in so many ways. And then you got to kind of adjust your life and depend on other people, which becomes hard from the patient's point of view. And then as a caregiver, the caregivers feel responsible for their loved ones. They feel like it becomes their responsibility or duty to, make sure they're looked after properly. It adds added stress to take somebody back and forth for their medical appointments because you have to sort of balance work and and the expense that all comes with it. So those are sort of the issues I notice, especially when we're dealing with illness within our own family and dealing with the patients. And a lot of times we've had people kind of just experience significant anxiety with poor sleep, issues with performance at work, and just overall stress. So those are the things we want to kind of bring out here, kind of share your experience with us, and we have an expert panel to kind of help maybe guide, resolve some of the issues. Like I said, I don't think I cover it all, but I think those are the issues that are usually kind of become responsible. I look at my own father, who's pretty elderly now and has been sick for a while, and my mother who's, constantly, like her whole life is revolved around taking care of him. And I frequently tell my mother that, he has to take some responsibility for his own care so you can get a little break. But that sort of interaction sometimes gets very difficult to separate out for both their well-being. So those are, I think, real issues that come about no matter how much you care and love each other. So with that, I'm going to let my panel introduce themselves and give a little insight into different aspects of these kind of issues. So you want to go ahead?
Can everyone hear me? Okay, great. My name is Dr. Lippy. I'm a clinical psychologist. I work at UT Southwestern Medical Center here in Dallas. Typically, when I introduce myself to new people and, I'll tell them that I'm a psychologist, and usually the reaction that I get is something like, oh, something along those lines. When I continue and I describe more about what I do, and I describe that I work primarily at a hospital working with patients with chronic health problems such as pulmonary hypertension, that response changes to more of a, To me, that suggests that they're not quite certain of the relationship between psychology or mental health and such a medical problem. They think, this pulmonary hypertension, well, those are real symptoms. The patient aren't making up things. They're not crazy. What is the psychologist doing involved with such a bodily or physical process? Some of you, in fact, may be wondering the same thing. Why is the psychologist here at a pulmonary hypertension conference? So I hope to just kind of briefly overview that relationship between our mental health and our medical health as well. one of the first points that I wanted to stress this morning was that having some kind of emotional response or reaction to either learning of a diagnosis or living with your diagnosis is totally normal. We would expect some kind of response, things like sadness, anxiety. What does this mean for my life? Anger, sometimes guilt, feelings of isolation or loneliness. These are all kind of common experiences that we have. Can anyone relate with some of those terms that I just mentioned? Yes, I see a lot of heads nodding. So there are normal expected responses. Sometimes when your mood concerns, the anxiety or stress becomes more severe, or it can really start to impact the different parts of your life. We know that about statistically 1 in 3 individuals with chronic health problems develop a major depression at some point. You compare that with approximately 1 in 10 individuals in the general population that will develop a major depression, and you can see that there's a really strong relationship, and there's people with chronic health problems may be at increased risk of developing a depression. Sometimes the responses that we face, especially for the patients in the room here, can be specific to the symptoms that you're experiencing. Anyone ever been short of breath before? Anyone ever had discomfort in your chest, pain problems, chronic pain problems? Okay, lots of hands raised here in this room and lots of heads nodding. When you experience, for example, shortness of breath, do you tend to feel relaxed, calm, cool, comfortable? No, of course not, right? It tends to be the opposite. That can be very distressing. It can cause anxiety or frustration. Oh no, here it comes again, these feelings. Sometimes as well, maybe I can open it up for your thoughts as well. What are some other responses that you have when you notice some of these physical symptoms? What do you notice? How do you feel? I'm sorry? Panic. Yes, good one. Panic.
Guilty because you can't do as much as housework, and you got to put more on your side first.
Okay. Yeah, absolutely. Absolutely. Anything else? Frustration. Yeah, absolutely. So these are, again, some examples of that relationship between our body's health, our medical health, and then the emotional side of things, how we respond in terms of our mental health as well. For the caregivers in the room, there are certain expected kind of responses that can happen in that role as well. Anyone want to kind of offer some thoughts on, from a caregiver perspective? What are some of the emotional responses that you experience?
As a caregiver, after 2 years since my wife was diagnosed, I found that there's as much frustration from her frustration as there is going to all the doctors, the test. And we've been to 3 different hospitals. We're lucky to have such great doctors in our area. But the major frustration, I think, from my side, is the doctors do have, through the internet, the ability to look at all of the different tests that are being done. But they don't talk to each other. And that just frustrates, pardon my French, frustrates the hell out of me, because we feel as though not only do we have the situation at home, but we're always trying to get the answers. And you can prepare all the lists you want, but the doctors are so overworked that they don't have the time to go through it. We have a great pulmonologist, but I think he now has over 600 PAH patients at one facility, and he's trying to bring in more pulmonologists. But then you get the heart people, and now we've got, we're now looking to incorporate Charleston, South Carolina from Tampa as for another study. It does get frustrating. I found that for my health, that I had to unretire and go back to work on a part-time gig just to have something to do, other than just worry. And I keep that phone in my pocket, and I'm waiting for that 911 call from her that, hey, I need you. But, I don't know if you have any answers for that, or if that's just normal.
Well, First of all, thank you for that comment. And I'll let some of my colleagues join in here as well. Just briefly in response, I think you brought up several important topics that I wonder how much everyone else can relate to as well. This idea of burnout, this idea of frustration with the medical system in general, perhaps the providers that you're working with. There may be some difficulties there as well. I think you're not alone. Is that a true statement for me to say?
Yeah. So I think I'm going to take, you raised a lot of points, like there are many things we can break up here. So I'm going to let the other two speak a little bit, and we'll come back to that whole, because I think there are 3 or 4 issues within your comment that we can get to. Go ahead.
Hi, I'm Josana Rodriguez-Lopez. I'm from Massachusetts General Hospital in Boston. I work at Massachusetts General Hospital in Boston, and I'm a pulmonary hypertension doctor, and so I hear you. It's very hard as a doctor on the other end of the spectrum to get all these records together, but I do think it's part of our responsibility as caregivers to patients with complex medical problems to take the time to review all these studies that have been done and try not to repeat studies that are unnecessary to decrease patient burnout and caregiver burnout. I think that's a really, really important point you brought up. I think one other very important point you brought up is this burnout, and one of the points I wanted to make is that both for the patient and the caregiver, it's really important to take time for yourself and distance yourself from the illness for a minute. And you said for you that meant going back to a part-time job and, you know, getting rid of this guilt that you have that you're not 24/7 with the patient, because if you don't, as the caregiver, take care of yourself, you won't be able to take care of the patient. So I think that's a really important point that you brought up. Thank you. As far as other things I wanted to talk about today, I think the mental health aspect is extremely important. I also wanted to talk a little bit about making sure that both patients and caregivers understand the disease as much as they can. So I think one of the issues that comes up with doctors not having enough time is communication and issues with communication. These are very complicated medical problems. And as a patient, your right is to make sure that you understand what the problem is, what your medications are, what the side effects are, and that you're able to communicate that to your support system, to your loved ones, to your caregivers, because they're going to be dealing with this when you go home. So, you know, this concept of taking charge of your medical care, taking charge of your illness, it's in part the doctor's responsibility and the patient's responsibility as well. My nurse said this quote to me that I thought was really good, is you can't control whether you have pulmonary hypertension. It's something that you can't control, but you can control what you do about it. So as a patient, it's very important that you do take the time with your doctor or with other healthcare professionals that you may be seeing to understand the disease, understand what's going on, understand what to expect. If you're starting a new therapy, understand what side effects are going to happen. And one of the things I want to emphasize is it's not only your doctor. Usually pulmonary hypertension centers are a team. So take advantage of that. If you have a nurse practitioner that works with your doctor, maybe they have more time to sit down with you and explain things to you that you may have not understood in your short visit with the physician. Also, at the end of the visit, make sure you sit down and repeat everything that the doctor said to make sure you got everything and that you understand the instructions, and that's really important. It may take 2 minutes, but it kind of summarizes the visit and really emphasizes to the doctor that you understand what the plan is. The other thing I wanted to talk about is just make sure you have a good support system, and everybody who's in this room today, obviously they're here because you're either a patient or a caregiver, and just make sure that support system is also doing well mentally, taking care of themselves so that they're able to support you. And I think I'll stop here and I'll...
And you want to talk a little bit about the work and
Sure.
care balance?
Sure. My name's Nimi Tarango. I'm a nurse practitioner from the hospital at University of California, San Francisco. And I am going to speak a little bit about ways that once you have the established diagnosis of pulmonary hypertension, how can you make things a little bit easier on yourself and your caregivers and your family and your support system. So I wanted to start by talking a little bit about physical health and energy conservation. I'm sure that many of you have your good days and your bad days, and it's incredibly normal for you to have days where you feel like you don't want to get out of bed at all because you're too fatigued or exhausted. So one thing that we like to talk about is energy conservation. So realize that things that you used to do very easily, like taking a shower, getting dressed, can now make you exhausted. If there are tasks that you need to do outside of the home, most patients find that early in the morning is sort of their best time if they've had a good night's sleep. So try and create a to-do list and realize that you're not going to get it all done. So prioritize your tasks and try and do things in the morning. Realize that if you're going, you're going to be laid out for the next 24 to 48 hours because this really takes a toll on you. Some other things that you can do within your home are sort of ways to help you, and some of this, definitely is difficult based on your socioeconomic status, but I've had some patients actually put blocks underneath their washer and dryer to make it easier to do their laundry, and that's one way to take away some of the guilt that you may feel, because certainly it's really hard to bend down and pick up a laundry basket. But if you have a washer and dryer that's up at your level, you may be able to do one load of laundry every now and again, and that's a way that you can empower yourself and as well take away some tasks from your family or caregiver. Putting grab bars in the shower, just making your home safer and more easier for you and sort of taking off some of the stress. Relying on family and friends, which I'm sure all of you do. I have a patient who there's an online tool where you can set up a calendar, and she has her family and friends sort of plug in dates where they can help and take a patient to the grocery store or to get their laundry, where you're not always having to rely on that one specific person. I don't know how many of you take advantage of a handicap placard, but if you don't have one, you should have one. I think one of the hardest things about this disease is that it can be you could be invisible. It can look invisible, and some patients will say that their family or friends don't understand what pulmonary hypertension is because you look so good, and how can you be so sick? I just don't understand it. Is it high blood pressure? But one thing that I read online is that you don't get brownie points for suffering, so take advantage of the things that you can take advantage of. And I had one patient she was diagnosed with lung cancer after being diagnosed with pulmonary hypertension, and as she started to lose her hair from chemotherapy, only then did she say, now I kind of felt okay using my handicap placard because people could tell that I was really sick, and that was really heartbreaking to me. As Dr. Lippy said, definitely, I think all of us have echoed getting the mental health for yourself and for your caregivers. I'm kind of just jotting down a list, so it's a little bit out of order. But one thing that I found that's helpful for patients if they get care from other providers at the same center is ask them, can I group my appointments on the same day so I don't have to come in 1 week and then 2 weeks later and then, and try and get my studies done on the same day. In California, and I don't know if nationally this is a benefit, but patients with Medicaid that live over 60 miles from our medical center we can get them an overnight hotel so that if they have to stay for multiple days. So please take advantage of all the things that are available to you.
I think that's a great point, and I don't think you should feel like you're burdening your doctors by asking. You don't lose anything by asking. And I know in our clinic we really make a big effort to try to accommodate patients. We know you may be on oxygen. It may be hard for you to get out of the home. So if we want to get 3 tests, we do try to accommodate patients and schedule them at the same day or at your convenience. So never feel like you're, annoying your doctor by asking. The worst thing they can say is it's not possible. But as a physician, you really will try to accommodate that.
So for those who go to big centers, just remember there are many people between your doctor and your appointment. So the doctor might have their nurse who works very, very closely with them, and really the nurses who work in the PH clinics tend to be big patient advocates. It's just the nature of who gets into those clinics. But then, when we set up all those, the physician sets up all those orders, all those tests, it's the scheduling that does it. And in different places, the scheduler could be somebody that is very closely associated with the doctor's office, or it could be more central system. When it's a more central system, it's very impersonal, right? So they don't understand what you're dealing with, why the appointment needs to be made when the doctor asks for it. So before you leave, it's not a bad idea to say, how quickly do you want me to get these appointments done? And the nurse can tell you. And then if the appointments come your way and they don't look the way the doctor wants them, call one of the nurses. I can tell you in 99% of the centers, the nurse will respond and make sure it's to your advantage, because the nurses know what you're dealing with. That central scheduling or the scheduler up front doesn't realize how complex this disease can be. Just, sometimes you just, and once they kind of get to know that that's what your requirement, probably the scheduler also falls in late. But just remember, there's a big distance between the doctor and the scheduler. And if you're not getting what the doctor said you should, communicate back to the doctor, and usually the office can help. So I'm going to open it up and see if somebody else has any suggestions, questions. Yeah, go ahead.
I have two questions. The first one is regarding the faith towards the doctor, especially when the doctor is not paying much attention. Doctor don't have time for each patient, to share everything. So I don't blame doctors. But the thing is, particularly in my case, I was misdiagnosed twice. First one was some heart disease, whatever, and then it didn't work, or the medication didn't work. And then my iron was 22.8, and they said, oh, it's polycythemia vera, something. So, and then they did me phlebotomy, another doctor, after 2 years, and then finally I got diagnosed with PH. And still then, my caregiver, everyone has a doubt. Maybe this is also the wrong one. I know, how can we trust this doctor, right? And then until we came in 2014 in Indianapolis, and then look at the saturation, which is like around 80s, and look internet world now, right? And you can judge yourself. Okay, I think this doctor is right. But the problem is, again, the doctor cannot give more time. So it's a very, very valid thing that we have to have a really maybe more familiar with the doctor, so that you can really, this is the real diagnosis, this is the true doctor, kind of thing. So, so that timing, that trust for the doctor, for the proper diagnosis, and then trust for the caregiver also. Yes, this is the real doctor, right? And this is the real disease. That's one point. That's one of my comment or question. The other comment I can add, like the same thing, regarding the energy conservation that we discussed. It's a great for many patients. But on the other way, the other side, other part of this is, I particularly tried the other way around, not the energy conservation, but try to avoid those, because my bedroom was down. I tried to make it, now it's up. I try to walk up. So because in the part of the day, we don't exercise. We're lazy guys, So what we do is we need an exercise, of course. Excuse me. Sorry, a little short of it. We need an exercise. So what we do is, I have a handicap parking, but what I do is sometimes I try to park a little far so that I can walk to the store, So I don't do exercise at home, lazy. So these things, rather than conservation of energy, what I do is I try to avoid, and then so that I can have more exercise during the daily work, daily life. So, but you are right. Of course, for some of the patients, it is very hard, so you need a conservation of energy. But on the other hand, maybe what I'm doing maybe is not that bad. So that's make up. Thank you.
So I think we'll address the issue of trust a little bit, but the energy conservation, it's again, everybody finds their own balance. But my philosophy is very similar to Nimi's. We put patients on very complex medications. It's impossible, like when patients ask me, Doc, can I still continue to work? Should I give up my job? And I always say it's your personal decision, because, coping with the job and illness and where you want to spend time and what you can do is very difficult. So the same is true. We put patients on complex medicines. I want them to have a full life on their terms, like what they want to do. It's not for me to decide, well, now you can walk 400 meters, so you should be working. That's not my decision. How they feel is their physician, and how they want to spend their time is theirs. So I'd rather have a patient be able to go to the mall and walk through the mall and not have to expend all their energy walking in the car park. You see what I'm saying? So that's why, even though I'm a big advocate for all my patients, stay on their feet, I think twice before giving them, wheelchairs, but I never hesitate to give them a disability placard, because get to the mall, get out, it's good for the brain, it's good for the body, it's good for your social life. And that's what I want people to sort of lead the life they want to the best they can. And with that, I'm going to ask Ben to talk a little bit about the trust issue amongst the physicians.
Sure, right. I think that's a very important topic. In fact, the relationship that you have with not only your physicians, but everyone on the staff at the various medical centers that you may be working with, having that trust. If it's not there, then that's something that I would encourage you to bring up. In fact, I think by and large, and feel free to correct me if I'm wrong, but I think by and large, most providers would be more than willing to hear your concerns. That way, if there's something that can be addressed at that time, then that's something that is a way to build trust. You have an open line of communication with them. Another just kind of general tip is to get to know your treatment team. Know them by name. When you walk into the clinic, be able to say, hello, Amy. Hello, Meredith. Hi, Bill. These are just kind of very simple things that over time can build into a meaningful relationship and kind of contribute, in fact, to that trust. When you feel like I have a connection with this team, there's support here for me. And you can say them by name, and they'll be able to say you by name more often than not. And I think that's kind of a general tip that I would encourage for everyone to help build that trust, is get to know your team. And that goes for both patients as well as caregivers. Get to know your team.
And the other thing I always feel is, it's easy to feel frustrated. You feel frustrated because the drive to the doctor's office was bad, you got stuck in traffic, you just had a particularly bad morning. You arrive in the doctor's office and you're frustrated, but you don't want to be rude to the doctor. Nobody does, right? But it's okay to express those emotions. It's okay to, I will frequently ask my patients, why you seem a little frustrated today. What's irritating you? Tell me. And it could be something I said, didn't, the phone call was, it could be me, just as well as anything else. But I think trust builds if you're able to express your emotions. And if the care provider can't handle it correctly, then it's not probably a good match. Sometimes you don't have a choice, sometimes you have a choice. And would you agree with that? Or I could let the...
One thing I want to add about the trust issue is that a lot of people have their local pulmonologist or local cardiologist that they've been following for years. and they may trust this physician, and then they're diagnosed with pulmonary hypertension and they are sent to maybe a farther away center, a new doctor, a whole new team. And that can be intimidating for a patient, to start over once you've already had this therapeutic connection with somebody else. And this came up this morning as one of the questions in the breakfast. And you don't necessarily have to break up with your doctor that you already know and trust and love. So a lot of times pulmonary hypertension doctors can work together with your local doctor and make it easier for you. Maybe you don't have to drive, the 2-hour drive every single visit. You can see your local doctor and they can talk together. So just because you have a new and more complicated disease and need to see a different specialist doesn't mean that those two physicians, that the one you knew and your new one, can't work together to help take care of you.
I just wanted to address the gentleman's comment about trying to stay active. Pulmonary hypertension is a covered diagnosis for pulmonary rehab, and it is a formal exercise program that's covered through almost all insurances. And I've had a lot of patients tell me, I can't exercise, I'm on oxygen, I'm on IV Remodulin. There's no way I can do it. The nice thing about pulmonary rehab is it's a formal exercise program with healthcare providers, usually nurses, respiratory therapists, occupational therapists, physicians, where they monitor you and they start you from where you are. If you can only, walk on the treadmill for 1 minute, they're going to start you right there and they're going to give you goals. So if you haven't already considered it, it might be something to talk to your care provider about. There's rich clinical data that shows it provides as much benefit as some of the medicines that you're taking. So even if it's just sitting down and picking up soup cans and lifting your legs, the more you do, the more you'll be able to do. Just something to keep in mind.
And it's another way of having a support system, because you'll also meet other patients. They may not have pulmonary hypertension, but may have COPD or other sorts of lung diseases on oxygen. You'll see them getting motivated, getting on the treadmill. You may make new friends. You may get motivated yourself by seeing that other people can do it as well.
And I'll add one more brief point, and I agree with both of you very strongly. And kind of from a psychological standpoint, something that we often do is we think in kind of all or nothing terms. Well, can I work or can I not work? Well, can I exercise? No, I have this pulmonary hypertension. I can't do exercise anymore. Well, that misses all this middle ground of, like you mentioned, there may be smaller incremental steps that you can take. So be mindful of your thought process. Am I thinking about this in all or nothing, black or white terms, or is there may be some gray there in between that I can work with?
Okay, I am the caregiver for a 30-something-year-old daughter. And, yeah, I know people look at me and they think that I'm the one with PAH when we're together. But I'd like to have some tips between being truly supportive and being truly encouraging independence. That seems like a balance that we're always going through.
Similar in some ways anyway to the advice for working with your treatment team, this idea of communication is very much important. If you're starting to have concerns about that and saying, I really want you to be able to kind of push yourself here in this moment, I think this may be a good opportunity for you to demonstrate your abilities here and your independence here. Being able to have open conversations about that, I think serves you well. It may be that each individual caregiver and patient have slightly different relationships, and so it's hard to answer that question with a catch-all piece. But I think being able to have that open dialogue and communication is a very good starting point. I'll pause right there.
I found that the more knowledgeable that the caregiver is, which I undoubtedly suspect that you're very knowledgeable about the disease, but I find that the more knowledgeable the caregiver is about the disease, the easier the communication comes, because there's an understanding of the disease. But, I wrote this down in bold here. Communication is really the key. And taking time for yourself, as well as, having some time away, is incredibly important, because I think it brings back a refreshed caregiver and a refreshed patient to be able to have these sort of sometimes difficult conversations. And your daughter's going to, do well, and then she may not do well, and so that's going to also change the level of independence that she may have.
And asking the patient what their goals are. I'm sure the patient may have their own idea of how independent they want to be, what things they want to achieve, and then try to see if you can help them achieve those goals. Maybe they do feel like you're taking care of them too much and they want more independence, but you had never had that conversation. So again, I think communication is key in this process.
Yeah, and I think that energy conservation applies for the caregiver as much as it applies for the patient. The other, I think that goals of care is an important point, right? So I think that conversation needs to be had with the doctor as well, so you kind of, whether we achieve them or no, will of course depend on, the response of the disease and many other factors, but I think it's good to know what our goals are so that we're all working on the same path, which is defined by the patient. I could say, well, I expect this, but if that's not what the patient wants, then it's not a fair place to push the patient towards. So I think the goals of care with the physicians, with the caregiver present, then we all kind of are moving in the same direction. And then whatever needs to be done is done.
Hi, you guys actually have answered quite a bit of it. My husband's a disabled vet in a chair, and I have been his caregiver for years. I got sick, and of course we don't look sick, but his service dog decided I needed more help than he did. So that's why I have her. But trying to get it through his head that I'm having a bad day, I understand he's having a bad pain day or whatever's going on with him, it's always he has to one up and be worse than me. It's like, fine, I'm going to work, I'm going to go do this, and I tend to leave. Unfortunately, my kids get the brunt of both of us, which is, I'm not sure how to address that with him to make him understand I'm really sick, even though I can still go to work part-time and do these other things.
Ben?
Sure. First of all,
You get all the easy questions.
That's why we put him in the middle.
No, in truth, it is a difficult situation. I think we can acknowledge that, and thank you for sharing that, by the way. One of the first things that came to my mind as you were describing that is that you're feeling like I need to be heard as well. I have things that are going on in my life, and I think by and large as caregivers that's something that does occur, whether it's your own illness, whether it's your busy schedule, whatever it is, you have lives as well. And so being able to share that information with the individual that you're helping to support or care for is certainly not uncommon. I think that comes up a lot of times, and different suggestions on ways to kind of help address that. Sometimes it can help to kind of have a third party, whether that's a professional counselor or just kind of a trusted family member, to kind of make sure, are you hearing what I'm saying? And then give them the opportunity to respond, because it may be that like you, they also have a lot going on in their life. They've got a lot on their plate. So we don't tend to do our best communication when we're at very high levels of stress. So being able, again, to kind of share your feelings and feel heard, I think, is important.
I think having a third party sometimes helps, and sometimes it doesn't have to be. Like, of course, if there's somebody with qualifications available, that's perfect. But sometimes if it's the physician you trust, it could be a family physician, it could be, the pulmonologist who's taking care of you. But, if that's somebody you trust and you feel is able to handle something, like having that discussion in the room while you're visiting the physician also can help, because then the physician can kind of sometimes help facilitate, what the degree of illness is and so forth, and maybe make the understanding provide a little bit more clarity to the issues.
I think it's very hard when you have a disease that's not common and you don't look sick. I mean, some people with PH are wearing oxygen, but not everybody. to have other people understand what you're going through. It's not like I have cancer. Everybody knows what that means, what that is. But I have pulmonary hypertension. Most people don't know. They're like, well, just take your medicine and you'll be fine. So I think trying to get your spouse or your loved ones to understand the disease, maybe take them to support meetings, maybe bring them to your doctor's appointments, to sort of understand what other people are going through and that this is a real serious illness and that the symptoms you're having are real. You're not making them up to make him upset or something.
And the other thing is people just keep doing what they need to do even when they're struggling. So I think the point you made earlier that you get no brownie points for suffering, I think all of us need to remember that. The patients and the caregivers, we all have to find our balance.
Kind of along the same lines, over here, sorry. With a young family, so my 10-year-old is my PHer. We also have a 7-year-old, and we've been diagnosed for about 4.5 years now. And there have been times when this disease has brought us together as a family, and there have been times when it's completely ripped us apart as a family. And I would say, if I had to sum it up where we are right now, I mean, we're approaching ground zero. I have a 2nd grader that shouldn't have to think about his big sister dying, but he does. And how that comes out is with extreme anger issues and extreme jealousy issues. He's jealous of what seems to be his sister getting all the cool attention and gifts and everything else. You have the sister being jealous of everything he can do that she can no longer do. And then in the parental relationship, you have the added stress of waking up every morning with these two going at each other. And we've done a variety of things. Little brother is seeing a psychiatrist. Our PHer, Madison, knows that counseling is open to her whenever she feels like she needs it, and she is very good about asking when she needs it, when she doesn't. And sometimes we do see the counselor, the psychiatrist, as a family unit. But we are at burnout. We are, all 4 of us are burned out. And so how do you go about climbing out of that burnout as a whole? How do we heal together beyond what we're already, what we already have integrated into our system?
Yes. I guess I'll start again.
They don't need us.
Yeah, no. This is actually part of it. It just kind of demonstrates how much teamwork, in fact, is necessary and the different perspectives. I'm sorry to hear that your family's having such a difficult time right now, first of all. I think a lot of people can probably relate to a lot of those issues, especially with children. I'm not a child psychologist, but it sounds like in general, children respond in the only way they know how. Sometimes that's acting out aggressively. They're not trying to be bullies or mean, but that's just kind of, they have all these emotions inside and they're not quite sure how to express them. And so it sounds like that's been something you've been encountering in your family. One general guideline might be whenever you set something called superordinate goals, that's just kind of a fancy term that means goals that everybody can agree on. These are goals that it's not specifically about me, it's not specifically about you. We all want to have a good day today. We all want to have a pizza party this evening, that kind of thing. If you can set a goal, and if we keep our behaviors, in check and be very concrete about, here's what keeping your behaviors in check looks like. That's talking nicely. That's telling me when you feel upset so that we can talk rather than no hitting, these kinds of things. And then you all have this collective goal that you're all working towards. Sometimes that can kind of change the focus from aggression towards each other towards this goal that everyone agrees on. So it just kind of sets your priorities a little bit different. One thought.
Yes. When my wife was diagnosed with this disease 5 years ago, I guess the goal was to keep her alive. And so realizing that she is going to live, then our goal is to have her more quality of life. Well, I try to plan things, events to go on in advance, and it seemed like whenever we do plan something, then she gets sick just at the time we're going to go. Am I imagining this, or is this something that's probably real?
I think, and and I'm going to take a shot at it first because he might disagree with me. But I think some of it could be changed. But I think stress really plays a huge role. When we're dealing with chronic illness, I believe, having done this for 20 years, and I feel like when we allow ourselves to get stressed for something else, I think it does have an effect on our physical illness. But
yes, no, absolutely it does. Chronic stress in particular, our bodies are pretty well designed to handle short-term stress, but when you have chronic stress over a long period of time, it can have an impact on your body, most certainly. I don't mean to in any way make light, but what came to my mind was it's like when you take your car into the shop because it's making that noise, and then as soon as you get to the shop, of course, it goes just fine. But this is kind of the reverse of that, where you've got all these plans, and it can be very frustrating when you've got everything set and in place, but then you get there and things don't work out. So how you respond in those moments, it can be challenging, number one. Judging by the reaction in the crowd, it sounds like that's something that a lot of people can relate with here, this idea of how do I adapt when I have these curveballs thrown at me. I think it sounds like one recommendation would just be talk with others. Talk with other people at this conference, for example. It sounds like everyone's been through that before. Well, what do you do in that situation? How have you responded? And then maybe you're able to share with them as well. Provide, okay, well, here's how we handled that situation. You may get some good tips, some creative tips as well on how do we stay flexible, how do we adapt, because that's something that, in fact, is pretty well required with
I'm at the point of just not planning something and just, okay, tomorrow we're going here.
I was going to
Well,
suggest
that's
that.
a solution. That's an option.
yeah, that's a great, that's an approach if you can do it. If you can go with the flow, whenever, you're, because with any illness, it's good periods, bad periods, and when things are looking good, maybe less ambitious plans, if you're planning a little trip rather than this big extensive trip, maybe something closer, but still it's nice.
Or sometimes what I do with my patients, if they're traveling to a different place that they're not used to, is giving them a security blanket, trying to find a doctor that's local to the place where they're going to be, that they can have the contact information, send them a little message, my patient's going to be in Florida for a week. I gave her your number in case something happens. And just having that as a safety blanket sometimes helps.
Mm-hmm. Hi, I don't know that I really have a question, but you were talking about not trusting doctors and so forth earlier, and I have learned, because it took 8 years for me to be diagnosed, and I've now been diagnosed and dealing with it for 9, I'm my own advocate. I was on Flowland first. I had an issue where it thinned the vessels, and I had pockets in the inside of my legs that came about with that. They wanted me to try Flowland. My question was why? It's the same thing. So the doctor called me at home and explained that it's a different molecule. She couldn't guarantee that it was going to change something, but she hoped it would. So I'm like, okay, that makes sense. Let's try it. Just so y'all know, you don't have to do it just because they say make sure it makes sense to you first. I don't know how much you're going to agree with that, but I want it to make sense to me. And the other thing is my primary physician in like a clinical place, they switch all the time, or they go to a different clinic. So I've got to the point where I go in and I interview my doctor. Hi, I'm Lori Williams. I've got PH. I deal with the University of Iowa. Are you okay with dealing with them? Are you okay with them calling at the last minute and saying they want tests?
Great.
What do you know about PH? Are you willing to learn? Depending on their answers, depends on whether or not I'm going to be coming to them.
Can I get a round of applause for that?
And I've learned from planning the trips and going camping and just little things like that. If I'm going camping in 3 weeks, I'm having everything arranged and done in week 1. Week 2's rest. Week 3's trip. Because I know the stress of making sure I got all my medications, making sure I've got everything packed, making sure I've got extra oxygen. I'm wore out. And once that's done, then I've got that week of rest, and I go.
Those are all great suggestions. And really, I think it is mind over, it is mind over body. So if I always tell my patients, and I tell them, I can give you the best drug for you, which is perfect for you, but if you don't accept it, then it's not going to work. Nothing's going to work. So So I think that having that confidence that it works for you, it makes sense to you, I think is a very, very important part of dealing with chronic illness. So you should be able to get those answers. And sometimes patients will come to me and they say, oh, I'm sorry, I'm asking too many questions. And I'm like, no, ask away. Because if I can't answer your questions, then I need to figure it out myself. Because I should be able to answer every question you're putting towards me, because I'm the one coming up with the treatment plan. So please never hesitate to ask your questions. Just do it politely.
You're speaking in college and you're speaking elementary. Yeah. You can bring it down a few times.
Yeah.
So just, ask your questions. Just do it politely, because, we are kind of sensitive.
And I agree with you. Knowledge is empowerment. And as a patient, like I said at the beginning, you can't change that you have this disease, but you can change what you do about it. The more you know about the different treatments out there, about the disease, about the course, the better you'll be, the more educated questions you can ask your doctor. And we don't take it personally if you say, I'm not so sure I want to try this treatment. Why do you want to do it? Is there another option? That's what we're here for, and that's your right. Never feel guilty for asking your doctor or second-guessing your doctor. And make sure you've had all the tests that you should have had. I've done some of these sessions in the chronic thromboembolic disease pulmonary hypertension session, and I've asked how many people in this room have had a VQ scan, and less than a quarter of the room raised their hands. Well, that's part of the standard diagnostic algorithm for pulmonary hypertension. So if you haven't had that test, feel free to ask your doctor, why haven't I had that? It's your right as a patient.
Go ahead. We have another question here.
Okay, I'm Peggy Miley. I'm from Statesboro, Georgia, and I'm a support group leader. And a lot of the things that y'all are dealing with, spouse and caregiver support, have them join a group. Go to the group, have your caregivers, your children go to the group with you. It has helped my family tremendously. My husband was kind of, I'm not sure the word is right here, but angry, because more was thrown on him about having to do stuff at the house because I wasn't able. My son thought I was lazy, and going to these meetings, they see other people and hear about, what's going on with other people, and it's not just me.
Can I just add something? I wanted to put a plug in. This came in everybody's bag at check-in, and it's called My PHA, and it's an online support group or a website where patients and caregivers can log in and create their own profile. It's secure. But the top of it, it says, "You don't look sick," is never said here. So I think just by sitting in this room and hearing what other people's experiences are is so tremendously powerful. And to have an online place where you can do that is really invaluable. So you'll get a lot of tips and support, I suspect, from this website.
We have 5 minutes and one more question. After that, if you have time to maybe talk to the two people I know who had questions here in the audience on the left side.
Hi, my name is Sarah. A brief question about maybe a quick framework you could give me. Similar realm as Cheryl's question over here. We're a family of 5, this little guy 9 months, and then our PHer is 3 years old, and then our son is 5 years old. A lot of similar things going on in our family as Cheryl's family. And so my husband and the 2 kids are home, and we're here, obviously. So a similar thing, like what's a framework, what's a framework of what the family can do to try and set ourselves up for success for managing our mental health? Like, I see a counselor, and my husband does not. Our context is a little bit of a challenge for that, but couples, anybody from the audience who might want to give me some tips afterwards or whatever, we're trying to do a little bit better with our stress level and our relationship and our marriage and whatever. So a little framework like, are you doing this? Are you doing this? Do you do this, or be sure you're, so any of that. Go.
I'm amazed at how, I have a 5-month-old, it's our first. I am amazed that how you're handling this, having your baby here. It's amazing. To your points, though, I think that each individual taking care of themselves, taking those little opportunities during your day. I imagine that with several children, you have a extremely busy schedule, very limited personal time, but this idea of self-care, kind of helping keep yourself at, to manage your own stress as each individual in your family, and you encourage that for your children as well. Time to drink. Gotcha. So there's something called adaptive coping skills. That probably would not be in that category. But finding things that you are interested in that perhaps are more healthy, things like yoga, meditation, reading, taking a warm bath. It's challenging. So I think kind of going back to that idea of all or nothing, since we have such busy schedules, even if it's just 5 minutes, let your husband know, hey, now's my 5-minute time where you can go and do something that for you is relaxing, kind of let you kind of bring yourself down. That'll help your body kind of relax the muscles as well, kind of help with that energy conservation as it turns out. And you encourage your family members to do that as well. When everyone is kind of a little bit lowered stress, that makes a cumulative difference as well in the whole family system, if you will. Does that make sense? Okay. One thought.
I think we have time for one more question, and then it will be 10:30. She was first.
I have recently found myself as caregiver for 2 chronically ill people. My mother, who has PH, and my older sister, who has lupus and arthritis. My older sister is actually more disabled than my mother, but we are all living in my mother's home. And the fact that the counselor is up there sort of has implanted in me the idea that it would be nice if I could get all of us to have a conversation together, collectively and individually, so that we can learn how to be compassionate with one that, and we are all very strong-willed, and we all want to be very independent women, and I'm the one that has to help everybody be as independent as they possibly can be, but I also am the most high energy of all of them. Even if none of us were sick, I would be that person. So my desire to want to, oh yeah, let me do this for you. Plus, I am also the shortest. I'm only 4 feet, and they're all way above 5 feet. So my mother, who is 91 and a half, doesn't want me to climb on the stools and then the counter to get the dishes out, but I certainly do not want her to climb, and my older sister can't walk at all. So the fact that a counselor, so my question is, how do you find out, one, whose insurance could cover the counseling, and how do you go about finding the right kind of counselor, or anyway, whatever your position is?
Yes, great question. So again, the questions, if I understood you correctly, were based on kind of insurance. How do I find a counselor is the basic question that you're asking. So it may work a little bit differently state to state or country by country even, but by and large, you can call the number on the back of your insurance card, and they can give you a list of psychologists or counselors that are local to your area. So that it's not just a completely blind search for any counselor. You may want to also include a term when you're searching called health psychology or a health psychologist. these are individuals with a little bit of extra training or background in kind of that relationship like we've been talking about today with between our medical health and the impact that that has on the other areas of our life, including our families and kind of just basic practical problem solving that comes up on a day-to-day basis.